Brought to you by Express Care Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. We are talking about the importance and benefits of both vitamins D and E. Express Care's Dr. Jitka Lom is here providing insight, and now we'll check out some of our viewer questions, Doc, if you don't mind.
Sure.
Tammy from Jigo asks, can you overdose on vitamin D or E, and if so, what can happen?
Great question. Well, it's actually hard to overdose on these vitamins, but one thing people do is over-supplement, and several years ago a study was done on vitamin E because many people were taking it thinking it's an antioxidant, great for your heart. Actually, it turns out it was actually harmful. It was not helpful at all to the heart, and so balance is very important. So to answer your question, can you overdose? You would have to take about 40 times the supplement. You would have to take 40 days worth of supplement of vitamin D in one day to overdose yourself. So that's hard to do. Same thing with vitamin E. So you're probably not going to overdose. You could probably be spending too much money on your supplements, but just follow the directions on the bottle.
All right. Robert from Telefofo asks, is vitamin D or E deficiency associated with any chronic illnesses? And we touched on this a little bit earlier.
Yeah, we did. So vitamin D, again, deficiency would lead to mainly bone problems, muscle aches, weakness of the bones, broken bones, and then some of the other long-term diseases such as diabetes, high blood pressure, heart disease, even depression and mental problems. And with vitamin E, a deficiency is uncommon as far as symptoms, but again, you would get numbness and tingling, and you would have problems with balance. Those would be sort of the top two.
Okay, and now this kind of ties into Cecilia's question from Manila. She asks, my doctor said that I am vitamin D deficient. How could this have happened?
So again, your sources would be from the sunlight. So if you are an indoor person, you never get any sun, that might be one reason. Another reason is if you don't absorb your vitamin D, and that would be through the food that you eat or the supplementation that you take. Again, it's a fat-soluble vitamin, so you have to be absorbing your fat when you eat it, and that may not be happening, and that happens with certain bowel diseases, especially celiac disease and other conditions like that. So that would be something to check out, and you definitely need to supplement.
Okay, so Seth from Agate asks, I'm currently taking prescribed medication. Is it safe to take vitamins D and E at the same time?
It really is. It's fine to take them all at the same time. Yeah.
Okay. Daniel from Dededo asked, does vitamin D play a role in muscle function?
It does, because vitamin D again regulates your calcium, and calcium is used in the channels that make your muscles function. So if you are low on your vitamin D, you'll be a little bit low on your calcium probably, and then your muscles won't work as well. You might have some weakness in the muscles, some aches and pains, not as strong.
Okay, and Lou from Enarahan asks, is it true that vitamin E can help prevent cataracts?
No, it's actually not true. They did a study on that too. If you take a lot of vitamin E, they took about 2,000 people and watched them over 4 years, and the ones that took vitamin E didn't have any lower rate of cataracts, so that one's a myth.
Okay, so again, just to leave with our viewers, how much vitamin D and E a day should they take?
So if you're a healthy young person, about 400 to 600 international units of vitamin D is sufficient. More than if you're an older person, especially if you're trying to maintain bone health, about 1,000 units per day. As far as vitamin E, probably food sources are sufficient or a multivitamin. But if you want to take vitamin E on its own, for an adult person, about 15 milligrams per day. Okay, that'll take care of you.
And I wanted to ask you, for those of us with young kids out there, trying to get them to eat good is really difficult. So giving them a vitamin supplement, like a multivitamin every day, but trying to get them to swallow pills isn't going to always be effective. So are the gummy versions okay?
They are. They're actually
quite good. They're not too full of sugar?
Yeah, that's true. And they also have liquid vitamins for babies. So you were talking about supplementing for infants, and you can get Trivisol or D-Visol. These are over-the-counter vitamin supplements that are liquid. They smell a little funny, which is the off-putting part.
All right. Anything else you'd like to leave with our viewers?
I think just being aware of this is very important, again, because as people get older, their bones tend to get weaker anyway. So there's 3 things you can do: exercise, take a vitamin D supplement, and take your calcium along with a little magnesium. and to keep your bones strong.
All right, sounds good. Thanks, Doc, as always, for the great advice. Make sure to tune in next week when Dr. Lom will be talking about psoriasis. If you have a question, feel free to send us an email to healthyliving@kwam.com, or of course post it on the KWAM News Facebook page. Healthy Living returns right after this.